In this lecture, we will be covering chapter 24, which is growth, development, and aging. We're going to discuss the prenatal period as well as birth, disorders of pregnancy, the postnatal period, and aging. So in this lecture, we're going to capture some of the events that happen between conception and death. And an interesting little fact, the longest living mammal, not human, but Arctic whale, is documented at living for 200 years. Would you guys want to live for 200 years? So we'll begin by talking about the prenatal period. And the prenatal period begins at conception or fertilization and continues until the birth of the infant. Science of fetal growth and development is called embryology. So that's the study of the embryo and its development. It's so amazing to me that human life starts as a single cell, right? We have half of the information in the ovum and half of the information in the sperm, and those two join to make one cell. And over about 40 weeks of time, that one cell is going to develop into this amazing little fully functioning complex human. At the point when the sperm and the ovum join, we call this fertilization, or the time of conception. And fertilization to implantation of the egg in the uterus requires approximately 10 days. Now, as soon as the sperm and the egg fuse together, it starts to divide rapidly. And this fusion of the two is referred to as a zygote. And the zygote is going to begin mitotic division, mitosis, and it's going to start replicating those cells. 2 cells will become 4, 4 will become 8, 8 will become 16, so on and so forth. And in about 3 days, and this is what you're looking at here, we have something called a morula. And the morula, the cells inside it are going to continue to divide until we have this hollow ball of cells called a blastocyst. Now here we're looking at that progression from that one-celled embryo where the sperm and the egg fuse, and then we get that first division, day 1, and then those 2 become 4, those 4 become 8, and within about 4 days we have that morula that we were talking about. Now implantation hasn't occurred yet. That last image that I put a red square around is the blastocyst. And the blastocyst is defined as a hollow ball of cells. Now this cell hasn't grown any bigger per se than when it became the zygote. It's staying the same size, but all of the cells are dividing inside of it, right? And the ovum is specially designed to have all of these nutrients inside it so that these cells can begin to rapidly divide. So here we are at about day 10, and the blastocyst hopefully has found its way into the uterus, and it is going to attach itself or implant to the uterine lining, okay? Now, the blastocyst forms 2 main structures. One is going to be the amniotic cavity, and that is where the baby is going to develop. This is the sac or the amniotic sac. It's a fluid-filled cavity. And then the other part of it is going to become something called the chorion. And the chorion is going to become the placenta, and it inserts itself into that rich lining of the uterus. And there the placenta is going to develop this rich supply of blood vessels and eventually that umbilical cord so that it can support fetal circulation and fetal development. And here is just an image of that process from egg to blastocyst that we said takes about 10 days. And it's interesting if you look at the blastocyst, how these cells kind of fall to one side, and that that empty space is going to develop into that amniotic sac. So here we're looking at that process from implantation to early development. And I think this gives us a good step-by-step process where at number 1, we have fertilization, that becomes the zygote. Then it starts to rapidly divide by mitosis. And by the time we get to step 3, we have the morula, this solid mass of cells, and then by step 4 we're seeing the early blastocyst, and then implantation is going to occur, and you can see these cells have kind of settled to the side. And then in 6 we see the amnion, what's going to become the amniotic sac developing, and the yolk sac there, which really isn't that significant for humans. In other animals like birds and those kinds of things, the yolk sac provides a lot of nutrients, but for humans it has other functions like the production of blood cells and stem cells that later help to form the sex cells and the gametes and the gonads. So if we look at step 8, we can see that chorion is kind of circumferencing that entire blastocyst, and that placenta is starting to form right from the chorion. And then when we get to step 9, we can see that the placenta is developing. We can see the yolks, the body stalk there that's eventually going to become the umbilical cord. And then now the little critter is floating in its fluid-filled amniotic sac. The gestational period for humans is about 40 weeks, and it's divided into 3 3-month trimesters. And after that germinal phase, that first couple weeks, what will become the fetus is going to transition into what we refer to as the embryonic phase. And the embryonic phase is between weeks 3 and 8 of gestation. And at this time, we refer to the developing fetus as an embryo. And then around week 9, we're going to stop referring to it as an embryo, and we will start calling it a fetus, because this is the fetal phase. And that fetal phase of development will continue all the way to birth. I thought this kind of provides an interesting perspective regarding where we're at as far as our length of gestation and other mammals are. So those that are in yellow are pretty much similar to human gestation of 266 to 273 days. We rank right up there with the cow, the chimpanzee and the orangutan, and the dolphin and the reindeer. It's a little bit shorter gestation period than us, but the one that has by far the longest gestation period is the elephant. And then if you want to make some possums, you can make them really fast in about 13 days. At the beginning of the embryonic stage, all of our cells are stem cells. And remember, stem cells are unique because they're unspecialized. And these unspecialized cells can reproduce to form specialized lines of cells. So at this stage, and the book says they have their highest stemness or potency, and they can specialize into many different types of cells in the body. However, once we mature into adults, we have a few stem cells that remain, but they cannot specialize into as many different specific cells as during the embryonic phase. So we've talked about some before when we discussed the production of blood cells in the bone marrow. So white blood cells, red blood cells, platelets. We also have stem cells that are in our skin and several different glands, muscles, nerves, bone, and some in the GI tract as well. But in the embryonic stage, we have these stem cells that are going to differentiate themselves into 3 primary germ layers. And you can see them in this image here. They are the ectoderm, or the outer layer, the mesoderm, which is the middle layer, and the endoderm, which is the internal layer. And here, this is a good chart to see what arises from each of those tissues. The ectoderm stem cells are going to become structures that cover the outer surface of our body, like the skin, parts of the central nervous system, and neural crest cells, which form the pigment cells or the melanocytes. The mesoderm is going to differentiate into cells that form the bone tissue and the tubes and ducts of the kidneys, also red blood cells and head and facial muscles. And then the endoderm is going to specialize to form the digestive tract and the pharynx and the respiratory tract. Some terminology that we should be aware of is histogenesis, organogenesis, and parturition. Histogenesis, histo means tissue, genesis means the making of. So here, histogenesis is the differentiation of cells to form different tissues. Organogenesis, think organ, the formation of organs from those tissues. And lastly, parturition is that transition from the prenatal to the postnatal stage, aka birth. As we're nearing the end of gestation at that 39th week, the uterus is going to become a little bit cranky. The fetus is going to turn and position itself in that head down position so it can get ready to make like a baby and head out. The muscular contractions of the uterus will begin, and those are stimulated by oxytocin. And remember, oxytocin is an example of that famous positive feedback loop, right? Because those contractions are going to get stronger and stronger and stronger until the birth of the baby. So once those contractions begin, that is the beginning of stage 1 of labor. And over time, the cervix is going to dilate so that the baby can pass through the birth canal, out of the uterus and into the birth canal and out to meet the world. So stage 1 is going to complete when the cervix is fully dilated, and then stage 2 is going to pick up there, and stage 2 is going to end with the birth of the offspring, with the birth of the baby. Okay, and once the baby is born, then we're just waiting for the placenta to be delivered, and that is stage 3. And stage 3 will end as soon as the placenta is expelled from the vagina. If you've ever experienced a birth, then you will know that it gets kind of crazy in there when the baby is born. They want to make sure that mom gets to see baby, but they also want to assess baby to make sure that he or she is doing okay. And one of the ways that they assess baby is by using something called an APGAR scoring system. And this APGAR score of 10 means that we have a perfectly wonderful, healthy, bouncing baby boy or girl. So you can see here the points 0, 1, and 2, and they're looking at muscle tone, pulse, reflex irritability, appearance, and respirations. And this is going to be documented on the chart. Is the baby in excellent condition, moderately depressed condition, or severely depressed condition? Okay, so let's talk about how we get twins and what the difference is between monozygotic and dizygotic twins. Now, our monozygotic twins are identical twins. These twins are going to develop from the same fertilized egg. And why this happens, scientists still aren't sure. In fact, it wasn't until 2007 that scientists were actually able to observe the splitting of one egg in the laboratory. So still there's a lot that isn't known about it. However, these twins have the same genetic code and they're going to look identically alike. Dizygotic twins, we also refer to them as fraternal twins, and these develop from 2 fertilized eggs. So at some point, the ovaries produced 2 eggs, and they each got fertilized by a sperm. They will look differently, just like any other brother and sister would, and they'll have their own special genetic characteristics. So there's 4 different disorders that I want to talk about regarding pregnancy. So a couple of them are referred to as implantation disorders, and one of those is placenta previa, and it is that picture on the bottom left. That is what is going to show us what placenta previa looks like. So in that first image, you can see that everything looks really normal. The placenta is up in the fundus of the uterus, and then you can see their low-lying placenta, but still okay. And then that last one is where we have the issue, the placenta previa. So what happens here is sometimes that blastocyst will implant in the uterine wall near the cervix, and then the placenta develops across that cervical, that internal os, right, of the cervix. So what will happen is when the cervix starts to dilate, that's going to cause the placenta to pull away from the wall of the uterus, and that is going to lead to bleeding, and that can become a life-threatening situation for both mom and baby. Now, the top one on the left is representing placenta abruption, or in the book, abruptio placenta. And this is when the placenta spontaneously separates from the wall of the uterus. So this typically occurs in pregnancies of 20 weeks or more. Again, this can lead to severe hemorrhage and often results in circulatory shock and death of the mother within minutes. And a C-section would definitely be in order, and a hysterectomy may have to follow. Same thing with the placenta previa. We want to be able to recognize and diagnose that early on so that we can plan for mom to have a C-section so that we can control the situation there. So we want to do that before labor kicked in. And the top right one is something that the book doesn't talk about, but it might be something that you see in the field, and that is called creta. Accreta. So there's 3 different types. There's percreta, increta, and accreta, but whichever one it is, the premise is still the same. That part or all of the placenta attaches abnormally to the myometrium. So you can see the accreta is not as invasive as the increta, and then the percreta is even more invasive. So when that does pull away from the wall, it rips and tears away, and that can also result in hemorrhage and can become a life-threatening situation for mom and baby. And then last but not least, bottom right, we have ectopic pregnancy. A ruptured ectopic pregnancy is an emergent situation that we need to take care of in surgery right away because, again, it can lead to hemorrhage. So what happens with an ectopic pregnancy is that fertilization occurs in the tube, but the egg doesn't make the journey down into the uterus and actually implants itself in the wall of the tube and begins to develop there. Now, eventually, it is going to cause that tube to rupture, and because it is so vascular, there's going to be a lot of bleeding there. So it does become an emergency situation as well. And depending on the patient, the surgeon might try to repair the tube if they're within childbearing years and they still want to try to have another baby. Having 2 functioning fallopian tubes gives us a better chance of fertilization. So they may go ahead and try to perform a tuboplasty. Otherwise, there is a chance that they may have to remove the tube altogether and do a salpingectomy. 2 additional disorders that are associated with pregnancy include preeclampsia and gestational diabetes. Preeclampsia is still kind of a mystery, but experts say that they think it starts at the placenta. And remember that chorion develops these blood vessels that penetrate into the uterus, right? At the placenta there. And so the thought is that these blood vessels fail to develop properly. So if they're more narrowed or it's more difficult to push blood through there, then that is going to cause a backup in the system for mom, and that is going to increase mom's blood pressure. And then we have the beginnings of preeclampsia. If it is left untreated, then it can progress into something called eclampsia, which leads to toxemia. And some symptoms that we might see with preeclampsia is protein in the urine, headaches, vision changes, nausea and vomiting, decreased liver function, decreased urine output, and thrombocytopenia. And those decreased liver functions is what is going to initiate toxemia for the mom. So this can turn into a life-threatening situation, and at the point of toxemia can cause convulsions, coma, kidney failure, and perhaps even death of mom and baby. Gestational diabetes, so we're familiar with diabetes. Well, just gestational diabetes is an increased insulin resistance. Now, this is just the norm with pregnancy, that the conditions of pregnancy promote insulin resistance. And so what's happening is that the pancreas is not producing additional insulin to make up for that insulin resistance. So this can also cause complications in the fetus. if mom has gestational diabetes, that can lead to weight gain of the fetus, and that can complicate pregnancy and could also increase the chance of mom having to have a C-section, which we want to do it the old-fashioned way if we can. That's what's best for mom and baby. It's supposed to work that way, and if we can avoid C-section, we really need to do that. It can also increase the risk of hypertension that can then lead into preeclampsia. And here we are at a topic that nobody likes to talk about, and that is fetal death or miscarriage and birth defects. Miscarriage is the loss of an embryo or fetus, and it's before the 20th week. Technically, we refer to it as a spontaneous abortion, or sometimes in surgery you might hear it called a missed abortion or a missed AB. And that's the same thing as miscarriage. It doesn't mean the patient had an abortion. It means that the body aborted the fetus. Okay. If the baby is delivered after 20 weeks and it is not alive, that's referred to as a stillbirth. If there is a missed abortion, or a spontaneous abortion, then more than likely we're going to do a suction D&C, or a suction with dilation and curettage. So we'll bring the patient into the operating room and we'll use this suction device and a suction tubing and a special suction tip, and we'll go ahead and remove that contents from the uterus because there can be a lot of bleeding associated with a spontaneous abortion. Now, birth defects are developmental problems that are present at birth. All right, they can be inherited, which is referred to as a congenital abnormality, or they can be acquired. Acquired defects are typically caused by cancerous causing agents, or it can be caused by something like the umbilical cord being wrapped around the neck, and baby experiencing hypoxia can also lead to other complications as well. Another disorder of pregnancy is puerperal fever. Now, thanks to this guy, Semmelweis, that we see here, he was a Hungarian physician, and he was an obstetrician, and he worked in a clinic in Austria, and he witnessed 25 to 30% fatality rate from puerperal fever. Now, puerperal fever is an infection that is caused by bacteria, and it can track up through the reproductive tract and can eventually lead to septicemia. Now, here we are in the mid-19th century, and puerperal fever is killing 30% of moms, and they also referred to this as childbed fever. And Semmelweis, he noticed that the patients that were attended to by midwives had a much lower infection rate than those who were seen by medical students who would actually go attend to other patients or participate in autopsies and then go examine patients out on the ward. So his investigation showed that the midwives were taking great care to wash their hands in between patients, and he suspected this is why they had a lower infection rate. So he implemented this hand washing practice, and he advocated for hand washing and actually reduced the mortality rate from 18% all the way down to less than 1%. However, his other physician friends were not on board with the hand washing thing. They thought that that was crazy. But now, however, fast forward, pretty much puerperal fever is a thing of the past, and that is all thanks to Semmelweis. An additional postpartum disorder is mastitis. Now, mastitis is the inflammation of the breast due to infection by some sort of bacteria. And because of that, there can be a disruption in lactation, and therefore the infant isn't going to get the nutrition that they need. Those natural antibodies aren't going to be passed on to baby to kind of help them, boost their immune system in their first few months of life. However, milk can be supplied by another nursing mother, or it can be replaced by several breast milk substitutes that we have today. The other situation could be lactose intolerant from the infant. So the infant might not have the enzymes that are needed to break down milk sugars, and therefore would have to have some sort of substitute. So we have talked about the prenatal period, and the prenatal period ends at birth. And at birth, we start the postnatal period, and the postnatal period continues from birth all the way through our entire life. And so there are some common divisions of the postnatal period, and the most common ones are infancy, childhood, adolescence, adulthood, and older adult. We all know that as we age and mature, that there are various physical changes that go on in our body that occur between birth and maturity. So it's a continuous process, although we do kind of put some boxes around these different periods. Growth and development is a continuous process through our entire lives. The period of infancy begins at birth and lasts for the first 18 months of life. And the first 4 weeks of infancy, we refer to that as the neonatal period, and the neonatologist is going to be the one that typically takes care of the neonate at this time. So neonatology is a specialty concerned with the diagnosis and treatment of disorders of the newborn. And there's lots of changes that go on in the first 18 months of the baby's life as their immune system is continuing to develop, their cardiovascular system is continuing to develop, and they've gone from completely relying on mom for total support to now they have to use those systems to survive on their own. So there's a lot of changes going on in the baby during that first 18 months of life. And here we've listed out what some of those changes are in the infancy period. So the weight of baby is going to double by 4 months and triple within a year. And that's going to be a 50% increase in the body length in a year as well. Baby will develop normal spinal curvature by 15 months, be able to raise its head by 3 months, be able to crawl by approximately 10 months and stand by 12 months, and it might even be able to start running by about 1.5 years. Now, these aren't hard, fast lines. Babies have their own unique pace and how they develop. So these are just some common guidelines. After infancy comes childhood. So childhood is from that 18-month period to about 13 years in girls and 15 years old in boys. And growth rate remains rapid, but it's not as fast as the first 18 months, by no means. And the neuromuscular system is going to continue to develop. They're going to gain a little bit more coordination. Those baby teeth that started to come in at around 6 months-ish are now going to start to be replaced by permanent teeth and should have all of their permanent teeth shortly there after the age of 6. And by 14, if there's going to be wisdom teeth, they should be on the scene as well. Adolescence demarcates the teen years. Those you thought the terrible twos were bad, just wait till the teen years. Approximately 13 to 19 years of age is considered the period of adolescence. This marks the onset of puberty, and that means there's a lot of hormones that are raging in the body that are causing all of these different changes. This is the time in an individual's life when acceptance is really important. Being accepted by their peers, and they have all of these situations, changes going on in their body, and they're feeling different things, and sometimes that does have an effect on their attitudes. As you can see, this girl in this picture looks like she's kind of having a day. And then they usually experience a growth spurt in this time as well. That begins in girls at about age 10 and in boys at about age 12 and is typically complete by age 16. We have officially entered adulthood. There's still many developmental changes that are continuing to occur into our early or middle years of adulthood. Some examples are those growth plates, remember, that are at the epiphyses of our long bones. Those are going to start to close. So we're probably not going to grow anymore, right? There's going to be changes in other body components as well. Interestingly, the sinuses, right? They're going to acquire their adult placement. And as a general rule, adulthood is characterized by the maintenance of existing body tissues, right? We're really done growing. Now the degeneration begins, right? We've worked all of these years into adulthood, our body growing and developing and changing, and as we reach middle adulthood, all of that starts to change, right? And we're going to begin experiencing degeneration of body tissues. And here we have arrived at older adulthood. And the long and short of it is that none of us are going to make it out alive, right? And as we age, we are going to experience degenerative changes that are characterized by older adulthood. If we live long enough, we're going to get old, right? So the study of aging is called gerontology, and older adulthood is characterized by a process called senescence, or degenerative aging. Okay, that's the technical term for it. And unfortunately, like I said, that is going to eventually culminate in death. So the experts have several theories regarding aging. And like I said, this the end of this lecture is not a very feel-good topic, the topic of aging. But some theories that scientists have include nutrition, injury, disease, and other environmental facts affecting aging. So we've been exposed to our environment for all of this time, right? And we've been exposed to the sun and radiation and, you know, different chemicals that we've exposed ourselves to, either purposefully or accidentally. And all of that is going to impact the aging process. Cellular changes are going to occur because our genetic material is going to have taken a hit, right? So some cells just aren't replicating themselves in the correct way. So that leads to something called apoptosis, which means cellular death, and those cells aren't going to be replaced. And as we know, some cells don't replace themselves at all, or replace themselves and regenerate very slowly. So that process is going to be slowed even more. So we have that diminished capacity of cells to reproduce themselves. And then the last one is progeria. And progeria is a rare genetic condition in which a person appears to age very rapidly. So we'll quickly run through some effects of aging regarding the skin, the skeletal system, the nervous system, cardiovascular system, special senses, respiratory, all of our systems, urinary, reproductive, they're all going to experience degeneration as we age. So what's going on in the skeletal system? Well, there is, for females after menopause, an increased chance of osteoporosis. So bones could be more porous and could break more easily. Also, from wear and tear, there could be degenerative joint diseases like osteoarthritis, and maybe a knee has to be replaced or a hip has to be replaced. Maybe overuse, wear and tear has caused some sort of spur to develop as well. And then the skin, right? Just being exposed to UV damages our skin, but over time it loses its elasticity, and that collagen and elastin that made us look so beautiful when we were young and fancy-free is now, it's not there like it used to be, right? So our skin is not going to have that elasticity like it did, and there's going to be wrinkles, and it's going to be thinner because cells aren't replacing themselves as quickly. There could be pigmentation problems, and then also we're going to start losing our hairs. As the aging process continues, there's also a risk of developing dementia or loss of memory with aging. There's also other degenerative affecting conditions of the nervous system. Elderly people might not respond to pain like they used to, right? So in surgery, we might be putting them in a position that is out of their range of motion, but they're not really experiencing pain, at least right then, and maybe later they will because of that prolonged exacerbation of their range of motion or whatever. So their pain receptors aren't going to be as working as effectively. And then there is some risk of depression. However, I did read a study that said between the ages of 60 and 90, people are reporting like that's their most happiest years. And I'm wondering if that has to do with retirement or, you know, the kids are growing out of the house. I'm not sure. Our organs, what are our organs doing? They're going to continually be declining, right? Our kidneys aren't going to be working as well. Our heart's not going to be working as well. If we live long enough, we're going to get cataracts. Right? That's the most common reason for blindness in the United States is cataracts, okay? But we can fix those. We can fix cataracts, right? But we might need reader glasses, right? Now to read the newspaper, you know, our arms aren't long enough anymore. And so there's going to be a degeneration of our eyesight as well. So as we age, we become more at risk for developing glaucoma, which is that increased pressure in the eye, which also can lead to blindness, loss of hair cells in the inner ear. That is going to mean that we're not going to hear as well, right? So we might need a hearing aid, or we have to turn the TV up louder, you know, or put the closed caption on. And so it's going to, our ears aren't going to work as well. And the little bones in the middle of our ear, they're not going to vibrate as well. So they're not going to be transporting sound as well as they used to. Okay, so there's going to be impairment in hearing. Also, taste and smell is going to be reduced. Only about 40% of the taste buds present at age 30 remain with us at the age of 75. And because smell and taste is reduced so much in the later years, we might not want to eat, right? So a lot of times elderly people, they don't eat as much, or maybe they forget to eat, and then eating isn't as satisfying to them because their smell and taste has been diminished. Over time, our cardiovascular system is going to develop gunk in the pipes, right? And so that can lead to vascular disease, peripheral vascular disease, and that means that our tissues aren't getting the oxygen that they need. They're not getting the nourishment that they need. Fat deposits like atherosclerosis and arteriosclerosis can be a serious concern in the aging individual. And then, because of those situations, that puts us at an increased risk for hypertension. If you're not sad enough about the aging process by now, then let's talk about the diminishing response of our respiratory system, right? Bones aren't going to move as easily. Cartilages can become calcified. Maybe we're not going to be able to breathe as well. There's going to be wasting of respiratory muscles. Muscles are going to atrophy, and that's going to decrease respiratory efficiency. Respiratory membranes are going to thicken, and the movement of oxygen from the alveoli, which are supposed to be this one cell thick type structure, is starting to thicken, and so blood isn't going to be oxygen isn't going to be exchanged as well, and also blood flow is going to be slowed, which again can also lead to hypertension and heart failures, right? In the kidneys, the nephrons decrease by 50% between the ages of 30 and 75. Blood flow to the kidneys and the ability to form urine is going to decrease. This could lead to other complications, right? If we have renal insufficiency, there could be bladder problems, inability to void completely, or inability to hold the urine in until we want to void, right? So there could be some sort of incontinence that is going on there as well. The bladder wall can become weakened as well, and there could be a bladder rupture as a result. Then, to top it all off, menopause and erectile dysfunction. I mean, it doesn't get any worse than this. There's going to be changes in sexual response. Men are going to have a more difficult time achieving and maintaining an erection. The libido may decline. Women are going to have difficulty or maybe painful intercourse because those Bartholin glands and Skene's glands that help to lubricate the vaginal canal, they're not doing that anymore like they used to. Fertility changes. Women are going to go through menopause and they're not going to be able to reproduce anymore. Their menstrual cycle is going to cease to occur, and that typically happens between the ages of 45 and 60. And sometimes it pushes out past the years of 60, and that could be an arduous process. And then men may continue to be fertile throughout later adult years, 70s, 80 years old, they may still continue to be fertile. Hormone levels are definitely going to change. In the female, estrogen levels are going to drop, and that can lead to hot flashes, sleep disturbances, vaginal dryness, and osteoporosis. They may have to have some sort of replacement therapy, and replacement therapy can increase the risk of some cancers, stroke, and also blood clotting. Okay, the happy ending is that we've made it to the end of this lecture. I hope that it was helpful and that you found it interesting and beneficial to your learning. Thank you.